following program is available in high definition on Channel 700. This program is designed and produced by the community with the support of TV Cogeco.
Hello and welcome to Oakville Matters. This is a community television show that looks at the issues and the matters that Oakville cares about. And today, one of the things that Oakville cares about, and we're going to explore in depth, is what's available in the way of mental health help in our community. And because mental health is an increasingly important topic all over the country and indeed all over the world, but no less in Oakville, this is only a selection of what's available to address this issue. But with me today are Zoe Gordon, who's the manager of OneLink, and Jason Barr, the director of client services and program director of the Canadian Mental Health Association in Halton, and Mark Cox, who's the manager of South Halton Stride. Mark, explain what STRIDE is and start with how you got that acronym.
Well, STRIDE stands for Supported Training and Rehabilitation in Diverse Environments.
Okay.
We call ourselves STRIDE because we don't want to give that full mouthful all the time. We got that title 15, 20 years ago, and our sole mandate is employment and getting people trained, ready for employment, help them find employment, help them maintain employment. So that's why training and rehabilitation.
And Zoe, what does your new service provide?
Sure. So OneLink is now the front door to accessing mental health and addiction services throughout the Mississauga-Halton line. And OneLink, the lead agency is Halton Healthcare, so we're very proud to be a part of that with the new Oakville Hospital opening. And essentially, the mandate is to take the guesswork out of those in our community who need access to addiction and mental health services. We frequently hear 1 in 5 Canadians are affected by these issues, and the research and extensive stakeholder engagement in our community found that people just didn't know where to go to get the supports and services they need. So OneLink is funded by our Mississauga-Halton LHIN, and it will allow now folks to be screened by a clinician through OneLink to help take the guesswork out of where they need to go and get them connected to the addiction and mental health services that they need.
So, Jason, mental health seems to be at the core of a lot of what we deal with in the community. For example, at the police, we're discovering that 80% of the calls for help to the police have nothing to do with crime, and a huge amount of that burden is related to mental health. We I guess the most expensive responder you can send to anything is a police officer, because you've got to imagine all the equipment and all the training and the high pay and all the support that goes behind deploying police officers. It's very welcome to me as a community leader to see what appears to be a new focus on resourcing this sector. And I have heard a lot that Zoe's program is needed, because I hear from people that they don't know where to go. So the most important question for me is, how are you guys making sure that people know to go to Zoe to find out where to go?
Well, I think it's about clear messaging, and what we have on our website is that we have to be directed to OneLink, and there's no wrong door either. So even if somebody does approach, CMHA or STRIDE for that matter, or any other agency, the referrals can still be processed, right? So it doesn't matter, somebody doesn't have to start off with OneLink. They can start off anywhere else, and they're going to get help regardless.
Because the stigma around mental health, I imagine that one of its biggest problems is that we name our agencies to try to not to. It's almost like we don't call them what they are because of the fear of the stigma, but that hides them in a way from people, because then they've got to figure out, oh, this is really about what I need. Sure. So I'm curious to know how the mental health professions deal with that identity issue. Do you find that you have that identity issue in when you were setting your program up, Zoe?
Certainly. I mean, stigma is rampant across our community, unfortunately. I mean, there's been huge headway in the community. Bell Let's Talk, that campaign's coming up January 27th this year. And just getting people to have the conversation and labeling it and being upfront and talking about, I have anxiety or I have depression, and going to where it needs to go. And certainly when you talk about naming services, people have been traditionally hesitant to go and say that they're going to a formal community agency or to the hospital for that matter. And it's a work in progress. It's that we all have a role to play, whether we're a partner, a neighbor, a community member, an employer, to talk to people about these issues and not hide behind words that we're afraid to say, and be upfront and say, you know, I'm having a bad day with my depression. All right, how can I help?
So it must be a wide subject, a wide spectrum that covers the notion of mental health. Mm-hmm. But all along it, I imagine that one of the first effects of struggling with keeping positive mental health would be an effect on your job. And so it strikes me that employment winds up being kind of an underlying crucial element. Mark, how do people know, how do they become your clients?
Well, we've been around since 1983. Our sole mandate is to help Halton residents living with serious mental health and/or addiction issues to get ready for employment, find employment, and hold on to employment. A lot of the caseworkers in the community, a lot of the public have gotten to know about Stride, and because of the variety of programs that we provide, we've been very successful in placing people, in the case of our client group, who have an 80% unemployment rate normally.
Because to what extent, I mean, I've had jobs where I've left them because I thought if I stayed it would make me crazy, mm-hmm. speaking in a vernacular, but it would, you know, I'd be depressed and I'd be unhappy, and, you know, it'd affect my mental health. And I imagine that not everybody feels quite so self-confident or bold as to do that. To what extent does work, you know, bad work conditions generate any of your business?
We certainly find a high percentage of our referrals are from people who are struggling because of the pressures in the workplace. I mean, the ongoing pressure for extended work hours, demands, doing more with less, those pieces. And, you know, we talk very comfortably about absenteeism in the workplace, but there's a shifting language towards presenteeism, and that's the mental health language. And certainly Jason's group at CMHA offers a wonderful program, which is mental health first aid. And we've heard a lot, you know, we've mandated CPR in the workplace and that, but mental health first aid, giving employers the skills, giving colleagues the skills to recognize signs of addiction and mental health issues with their colleagues, so that people can have those conversations and be upfront to come back and be able to contribute to their best ability in the community. So
if insensitive employers are one of the generators of the problem, do we, when a person works with Stride, do you work with the employers that you place them with, or that you prepare them for, to help them become better employers?
I should go back a bit and explain. We operate a worksite training program. We operate on Whitecroft Road in Oakville, where people come in and do packaging, assembly work, and they learn basic skills they require for the competitive workplace. We have a transitional employment program with contracts like with Hydro and that to do grass cutting. And then we have employment specialists. The employment specialists are the ones that are interfacing with the employers, mm-hmm. and there is certainly a big stigma, even in the public. The Mental Health Commission of Canada has indicated that 46% of us would diss a friend if we found out that they had a mental health disorder. But if they had cancer, diabetes, we'd still be their friend. And employers are the same way. The mental health first aid and other programs like that are great for health and wellness in that job, in that company. But we're trying to deal with employers who just want no part of someone who has a mental health illness because they feel they won't be, because accommodations are often required, just like for people with physical disabilities. Some of the accommodations are things like maybe they can't work full time, maybe they can't work every day of the week, maybe they need time off during the day, longer breaks. So we're trying to overcome that with the employers, and we've developed a presentation that we're going to test next month on a group of employers, a focus group, to see if that would convince them to hire one of our clients?
Well, I know that over the years we've done all kinds of accommodation of the special needs of other segments of the population. For example, we let people job share when they want to, maybe two people want to split their time. They might have a family situation where they want to be more present at home, and they still want the job, and they need to job share instead of give it up entirely. We're that accommodating for these more, I guess we think they're more mainstream. So you're trying to get a similar flexibility for your clients.
Yes, we are, yeah. And it's difficult with some employers. Once they hear that there's a mental health issue or an addiction issue involved, they don't want to consider our clients.
So it sounds like one of the generating engines of the difficulty that you're dealing with is addiction and other issues around drugs then, I guess, alcohol and drugs. Is that, how big a part of the mental health picture is addiction? Maybe Jason?
Sure, addiction is a big part, and at CMHA we believe that they go addiction and mental health go hand in hand, and not necessarily saying that if you have a mental health issue that you're going to have an addiction issue, but I mean oftentimes they are co-occurring.
But if you have an addiction issue, you're probably going to look like you got a mental health issue.
Or having some symptoms of mental health, absolutely. Whether it's because oftentimes addiction does create some issues in your family life, personal life, and work life as well. Absolutely. And
I imagine that stress could also push you to addiction.
Absolutely, absolutely. I mean, a lot of addiction is about self-medicating, and people use it, to cope, and and for some people it works for a while, and then it gets out of hand where it interferes with their, their daily life.
So if it's a chicken and egg issue where you really can't tell which thing causes the other, you just find them together. Does society and employers in particular, do they do themselves any good trying to, I don't know what the right word is here, but shun or scorn or avoid people with these issues?
Absolutely not. And I think what happens, and I'm glad that you asked this, because what happens is if it's actually proven that if employers ignore these issues and turn a blind eye, it actually affects their bottom line. So actually to come out in front and deal with these issues head on, it actually affects their bottom line, and they can actually save money, by being supportive and coming out and being supportive to their employees to help them access, whether it's accommodation or services and that sort of thing.
So I'm picking up that at least part of what's going on is a bit of a train people to perform better in their workplace so they can keep their job, and not necessarily, and that's a separate issue than sermonizing them to stop using drugs or finding, that it's like there's a couple of different, maybe more than two, there's several different things running here, and you deal with each one as you can. So how do you deal with, when I was young, I guess what I'm struggling with here is, when I was young, I thought that you chose what you did, and if you were doing something bad, you just needed to be told in a way that you had to heed, don't do that, do this. But you're the visible proof that that doesn't work. Plus I've learned over the years that I've aged that that doesn't work. So how do we bring employers, since they seem to be the key to this entire thing, how do we bring employers around? And I should include myself in that, because I know that at the town and at the region, we employ thousands of people when you add it all up, police, fire, inside, outside. We have mental health programs, but we have limits as to how far we'll go. Mm-hmm. And I'm wondering if maybe, I'm not sure if I'm part of the solution or part of the problem after I've listened to you here.
Well, I think it's about educating, and I know that the CMHA does go into workplaces and try and teach and advocate for clients who have mental health and addiction issues. I think and Zoe and Mark had mentioned the mental health first aid that CMHA offers. There's also programs like Mental Health Works that go in and educate and consult for the employers themselves to educate them on how do I deal with this sort of thing, because a lot of times it's not just a matter of I don't want to deal with it, it's I don't know how to deal with this issue, right? So
we call this dealing with these things keeping a person employed who's screwing up, and whatever their mental health problem is, the work isn't being done satisfactorily, and either the customer or the taxpayer gets unhappy, and the employer is caught in the middle. It's in a hard spot. We have a thing, at least in public service, and I think in larger corporations, called accommodation, where the person can't handle the stress of this, and we find something else. So I don't think anybody'd be unhappy to know that if a police officer has post-traumatic stress, we and can't any longer do the direct interface with crime anymore because of the mental damage that they're going through, the healing time that they need in a hopeful way. We move them to a job or create a job for them, because it'd be cruel to take a guy who'd suffered it in public service and throw him out, right? But in the rest of the working world, this accommodation of the employee, because this is clearly, PTSD, post-traumatic stress syndrome. I think everybody accepts that that's a mental health issue. But we have I think we have generally as a society, we feel a sense of mercy. We feel like accommodating. Do you know what I mean? I'm struck by the way we don't feel like accommodating the others. It's like this is noble and the other is bad. How do we work through that? And don't feel like you have to take. I'm not here to tell you when you can talk. I'm here to try to have a conversation.
Sure. So I think one of the things you spoke a lot about the word accommodation is that as employers to focus on the workplace is that we can't be presumptive of what accommodation means, because it's going to be unique to each individual. And we've talked about individuals in the workplace being affected by addiction and mental health issues, but a lot of our employees are family members and loved ones of those, and we have got children and youth in our school systems that are struggling each and every day, and it's those individuals that may need to be at an early school morning appointment. For instance, we have a program at Halton Healthcare that helps youth through the Navigator program, which is a private donor-funded stream, where we have child and youth workers that go directly into the homes and help get kids out of bed in the morning who are suffering from mental illness. 7 in the morning, helping mom and dad, or just mom or just dad, get the child ready for school and effectively get to school. But that parent likely then has to be late for work. So when we talk about accommodations and we talk about what's needed, we have to bend and flex and not assume that what works for one person, what's the other. And frequently, in our education, we ask people to just say, what do you need? I don't want to assume what you need. What do you need to be successful? What do you need to be present at work? And how can I help make that happen? And I think if we really get more comfortable with that dialogue in our workplace, whatever then happens next, we'll have a more productive, healthier based workforce in Oakville.
It seems like in the old days, as a society, we put our energy into what I'll call exhortation or sermonizing or telling you eat your greens or pull up your socks, and maybe that's behavior modification or that's trying to modify behavior. And now for the last, I don't know, it's been a good 10 years or so that or maybe longer, that accommodation has been a response that's in the mix. It's not everywhere. Clearly, it's not everywhere. Do we need more accommodation? Do we? Which way do we go on this? On these polls between demanding that you pull up your socks and responding by providing an accommodation? Where do we need to? Is that in fact the thing we need to balance those two things, or is it entirely different?
Well, I was just going to say that, it's when we talk about accommodation, it doesn't necessarily have to be, this big, well-structured program where we say, okay, this person's going to work off-site in a place alone, and it can be something very small, right? I mean, you can have that. It's all about opening the conversation with the, the employee and the employer, and say, what can make things easier for you. And you may have somebody that is very stressed about getting their child at, having to work 8 to 4 because their kid gets off at 3:30, and there was a big issue about childcare, and having that conversation, say, what, as the employer, it doesn't matter to me if you want to work 7:30 to 3:30. Something very small like that can be so impactful. So it's just about starting that dialogue, I think.
No, I'm conscious that I've kind of left this really focused on the workplace, and I'm not sure that that's the proper weighting, because it may be that seniors and youth are a bigger problem. Where is the center of gravity of the mental health issue?
I should spend a little more time, I think, describing where Stride comes in. We're more trying to get people ready for employment. These are people that have not worked, or have not worked in a long time. That's our mandate. And we do negotiate with employers on accommodations. Job carving is something we've been very successful at, where we'll persuade an employer who says, well, your client couldn't do that job or that job, and we'll say, but he can do a bit of that job, a bit of this job, and together we can make a job for that client. And the big issue for us right now, and the government has funded us accordingly, is youth in that age group 16 to 24. And they've provided us extra funding for that, and they've also provided an employment peer mentor funding for 4 positions in that area. And that's helping us place clients, getting them ready for employment.
To go back to your comment, Mr. Mayor, around where we should be putting our attention. I mean, we've talked about addiction and mental health issues, but these are illnesses. I mean, substance use, substance misuse, those are choices people make to use a substance either recreationally and it's on a spectrum in terms of problematic behavior. But there's a tipping point where it's actually an illness, where it's the brain's chemistry. And when we talk on the mental health spectrum as well, people don't choose to have depression. They don't choose to have psychosis or bipolar disorder. It is an illness that they are born with and manifests across the lifespan. So really funding earlier intervention in our community, having access for parents when those first signs come up in their children. We can see these things at early ages 4 and ages 5. How do we provide those supports in our community? How do we get access through programs like OneLink to start the conversation, to get those supports in place so that we can support people across their lifespan into adulthood and into the elderly as well, to make sure that people can stay well and home in their community and live as full of a life in a recovery lens as possible.
So I've heard all my life about the baby boom, and I myself personally am sort of the front edge of the baby boom, and a certain percent of people as they age acquire dementia, and I think we all agree that that's not your personal choice. That's truly an illness or a disease. And we all, I think, are worried that that's going to balloon as the baby boom generation ages. Where are the greatest numbers of problems here? Is it youth and going to be elderly? Is it already? I mean, give us describe the full spectrum. Maybe
sure,
the Mental Health Association would be
I think,
the logical
I think it's
one.
across the spectrum. I think because they all affect one another. So if you were to think of, you were mentioning dementia, so you could see that somebody who possibly gets dementia, then you have the caregiver stress on the family who are taking care of the loved one with dementia, and so the attention may be diverted to the elderly parent who has dementia, and then perhaps not focused on the youth who is growing up in that house. So I mean, it's there's a big interplay there, is I guess what I'm trying to get at here. I mean, there's certainly, Zoe mentioned it earlier, the early identification. I mean, there's proof that you know, when you intervene early and when you identify and provide services early, that the outcomes are dramatically improved. So
even for dementia and elderly people?
Absolutely.
Really?
Absolutely.
How do you do that? How do you intervene early and make that better?
Well, I think with that, what the early intervention with dementia is all about educating people. And one of the things, and I see that, you know, in the media as of late, people are talking about dementia and how people can have, you know, very satisfying lives, even though they have, you know, dementia, and there's a good quality of life, and versus this whole thing of fear. And even if somebody knows that I think there's something going on here, they're afraid to come out because they don't want to, you know, discuss it. They're worried about what's going to happen. So with, you know, this education and coming out and saying, okay, I know that if I can get treated early, that my quality of life can be dramatically improved instead of, you know, suffering in silence, if you will.
And I'm going to leap to a conclusion here that if your loved ones are going to be your caregivers, learn early how to deal with you.
Absolutely.
You're going to be less of a burden on them.
Absolutely.
Okay. Well, honey, I promise we'll work on that. You know, if I forget where my keys are,
yes,
the family goes, dementia.
Right.
What age groups do you deal mostly with then, Mark?
All ages.
Really?
All ages, yep. We have programs aimed at adults and youth. And I just heard something interesting yesterday. We were at a meeting, and one of our peer mentors was, or actually one of our youth employment specialists was talking about using one of our peer mentors, these are people with lived experience who have worked, to sort of do shuttle diplomacy between the parents and their youth, because the youth says, you know what, I don't want to work. You know, the parents say, we want you to work. We want you to work and have decent jobs. So we can sort of negotiate something in the middle and say, look, you've got to work. Everybody works. Your mental illness is being treated. And the parents are saying, look, they may not be able to get the type of job you've got, but let's ease them in, part-time jobs, entry-level jobs. Let's get them used to working.
So how do people get to you? Where's the front door to get to you? If someone's watching now and they want your help, how do they reach you?
Most people don't, like, we're not like community living. All over Canada, people know about community living. Their client group are people with developmental disabilities. We're unique to Halton. You won't find something like Stride anywhere else in Ontario. And people are referred to us primarily through the medical profession.
So you're doctor?
Or caregivers. Yeah, doctors should know about us, caregivers should know. And you're only going to be referred if you have a mental health illness. Okay. You know, so we're dealing with the lucky ones. They've been diagnosed.
All right.
And you can access Stride through OneLink as well.
Yes.
They're part of our 10 community partners.
Same question to you, Zoe.
Yeah.
People who are watching who think they need help, and well, you're supposed to be kind of a one access point. How do people reach you?
Absolutely. We have a website, which is www.onelink.ca, and that gives all of the information on how to make a referral. We're also the front door for access to Halton Healthcare and Trillium Health Partners for their community mental health, ambulatory mental health programs run through the hospital. So if I go to the hospital,
they'll know about you?
They will, yep. And we're onboarding our community partners one at a time. We've learned from other initiatives across the province there is such an exemplary need for connecting folks to addiction and mental health services. To the west of us in Waterloo, Wellington, Dufferin, they have an initiative called Here 24/7, and when they opened in 2014, their volumes were about 10 times what they predicted they would be. So we worked very closely with them to understand we need to build incrementally to make sure that we can resource this initiative to make sure that people, we hear a lot about wait times, and we know the wait times are long for services.
Well, unfortunately, the time for the show has run out.
Oh, okay.
But I want to thank you, Jason and Zoe and Mark. I hope that if you need help or you know others who do, you're now better informed about how to find it. I know that I want to make sure everybody knows that in Oakville, mental health matters